So, Digby, we're now contemplating the next phase, in many respects, of the Trump era, and what that's going to mean for Donald Trump, what that's going to mean for Republicans in Congress, and what it's going to mean for the Democrats. And I think largely we are seeing the Democrats. We had Chuck Schumer earlier this week say that Neil Gorsuch needs 60 votes. Which indicates that they are going to attempt to filibuster. There's been some Senate Democrats who have been sort of squawking about other things, but frankly, I hope that they stay. You know, if Chuck Schumer is, if Chuck Schumer can't convince you to fight, I don't know who could. Frankly, him calling for a 60 vote threshold. But one of the things I want to talk about is a debate between Bernie Sanders and Ted Cruz this week over health care. And in a couple of areas, Bernie Sanders really put Ted Cruz on the spot, specifically when he asked him, do you believe health insurance is a right that Americans should enjoy? And Ted Cruz basically came back with a very long-winded song and dance about access. And then Bernie Sanders, in what I thought was one of the best moments of the debate, turned to a woman in the audience who had been complaining about Obamacare and said, well, did you hear that? You have a right to access to health insurance. But of course, you can't afford it, so you won't get it. You also have access to one of Donald Trump's houses. You just need to come up with $5 million to buy it. And he really made the point that that was insufficient. And meanwhile, the Republicans are offering a plan that the primary focus is built around this idea of high-risk state insurance pools, which existed in this country up until 2009. There were 34 of them. They operated in total at a cost of $2.5 billion annually. Now, half of that was offset by premiums, but there was only 200,000 people in those 34 state high-risk pools. 200,000 people. By Paul Ryan's own estimates, there's 4 to 20 million people who would be eligible if they had pre-existing conditions. That obviously would cost, I can't even do the math, frankly, but the only amount that he's put out available is $2.5 billion annually for these risk pools. And we're talking a difference of tens of billions of dollars. I mean, $1 trillion difference, I think, after 10 years in terms of what would be needed by his own calculations. They realize they are selling complete snake oil, but it's not just snake oil, it's poisonous snake oil. And they're terrified of this. And now they've got to go and start to legislate. And they have the cover of Donald Trump, right? He's the shiny object. But they're going to have to do something for their very angry base.
Well, they do, and the base is very suspicious of them already, that they are not going to deliver this, wonderful freedom that they've been telling them they would have under Obamacare. I think what people don't realize is that when the base of the Republican Party says that, the Obamacare is oppressive, it's terrible, what they want is magic. They want all of the benefits of Obamacare. They want people, I have to assume that most of the people who are opposed to Obamacare don't literally want children to die for lack of health care. They just think that there's some other magical market answer to all this where we'll all be paying less and having more. In fact, that's what Donald Trump promised. And Paul Ryan knows that's impossible. He knows it's going to cost a vast sum of money to insure people. The only way, the reason we have insurance pools is that, healthy people are paying in. It helps cover the people who are sick, and then, you, in the awful event that you get sick too, then other people will cover you. That's just how it works. It's a mutually cooperative enterprise. And, if you understand that, then you understand that you simply cannot remove all the sick people and put them into one pool and say, here, pay for it. I mean, I had a friend who was in a high-risk pool prior to Obamacare and was paying, and he had a heart episode when he was in his late 30s. So he was considered high risk for a heart attack, right? And he was paying a vast sum of money. I mean, it was
That's why there was only
ridiculous.
200,000 people nationally.
Exactly.
200,000 people
Exactly.
nationally. That's nothing.
It's unaffordable. Yes, they have access. Sure, you can buy into this. It's only going to cost you $40,000 a year for your premiums. I mean, that's the kind of thing that we were dealing with. That's the whole issue. That's why Obamacare happened in the first place, because of these outrageous, there were many people who just couldn't get any insurance if
Yep.
there wasn't a high-risk pool available. They just didn't, they had no choice. They were just screwed. But the people who did have, quote, access to high-risk pools, they couldn't take advantage of that freedom that they had to buy insurance because it was simply too expensive. So, we're right back where we started. The Republicans know it too, because they had a person who infiltrated the Republican retreat and actually recorded all these Republican representatives. But secretly recorded all these Republican representatives moaning to Paul Ryan, going, "What are we going to do? We don't have a plan. This isn't going to work. This is terrible. We're in a big mess." So they know it, but they don't actually know what to do about it. And I don't. The president's kind of out of this side of it, except to the extent that
he knows he made a promise, and he's counting on Mike Pence and whatever the rest. I mean, he's probably just sitting in the office going like, "I told you, you have domestic policy. Now give me a better healthcare program." And like you say, the problem is that what people want is magic. And the real question, I think, for the Republicans is, do they think they can get away? Because health insurance, really, there's such a small amount of people, not such, but only 20% of people really ever find out that their health insurance doesn't work for them. So they could, and is that a small enough people that they could actually just sort of push off all the sick people, hope that they don't make too much noise, and everybody be happy with very cheap, what they think is health insurance. But if they ever got hit by a bus, they'd realize like, oh my gosh, this wasn't really health insurance.